So in vasculitis, again, there is inflammation of blood vessels. The blood vessels may become narrowed, like I said, stenosis, blockage or occlusion, or the blood vessels may leak. This is going to result in lack of blood flow, and the lack of blood flow is what then leads to damage to internal organs. So for example, just as we heard with Kathy, damage may be to the kidneys, causing kidney failure. Damage could be to other organs like the lungs, the skin, the nerves, and so forth. So vasculitis is not one disease. As you know, it's a group of conditions, and there are a number of specific conditions or diagnoses that fall under this umbrella term. They all have blood vessel inflammation that makes them, that kind of binds them in commonality. They are considered autoimmune diseases. Autoimmune meaning the immune system is turning on one's self. Like I said, the immune system should normally protect us from trauma or from infection, but in this case, the immune system is turning against its own body, and the immune system is attacking blood vessels. The vasculitis conditions we treat with immune suppressants, that is, medications that dampen the immune system or suppress the immune system because we want to stop the immune system attacking blood vessels. And rheumatologists take care of people with vasculitis because we are considered experts in the treatment of autoimmune conditions. We have expertise in the use of these immune suppressant medications. But of course, as you all know, and as we'll talk some more, it really takes a team of specialists to take care of people with vasculitis, depending on the organs that are affected by the condition. So some additional common questions that my patients come up with is it becomes confusing when we talk about what are the specific diseases, right? So one physician may say the patient has vasculitis, but some folks may have Wegener's disease, and then the kidney doctor says you have granulomatosis with polyangiitis or GPA. So the terminology can be a little bit overwhelming, and we'll go through some of these specific conditions and names in vasculitis. So like I said, again, this is just showing kind of a picture that vasculitis is a general umbrella term, and there's all these individual diseases, giant cell arteritis, microscopic polyangiitis, GPA, eGPA. They are all different forms of vasculitis, and so they fall under this umbrella term we call vasculitis. So the issue is then how do we sort through all of this? How do we put patients into the specific category of these particular diseases?